As you know, May is Mental Health Awareness Month. This year, we're in the middle of an unprecedented pandemic, which is taking a serious toll on Americans' mental health. People are isolated, millions have lost their jobs, and schools have closed, placing an enormous amount of stress on parents and children to establish a new normal under less than ideal circumstances. Today, I'm speaking with former Congressman and renowned mental health advocate Patrick J. Kennedy to get his thoughts on what's next. Congressman Kennedy was the lead author of the Mental Health Parity and Addiction Equity Act during his time in Congress. And in 2013, he founded the Kennedy Forum, a nonprofit that unites advocates, business leaders, and government agencies in support of mental health equity. He served on the President's Commission on Combating Drug Addiction and the Opioid Crisis, and he's currently the co-chair of Mental Health for US, a nonprofit initiative designed to elevate mental health and addiction policy conversations during the 2020 election cycle. Patrick, I'm happy we get to speak today. So, can you tell me, what short and long-term effects do you think this pandemic will have on mental health?
Thanks. Well, certainly short term, everybody's feeling anxiety. I think there's a great deal of depression. All of this is brought on by the very real fear that people have of both contracting the virus and the very real fear that people will not be able to get their jobs back. The very real fear that they're not going to be able to pay their mortgages, pay other bills, the fear of financial insecurity. There is just a lot that is coming down on people right now, and it's not unexpected that we're going to see a great deal of self-medication as a result of this. So I think you're going to have, anxiety, depression, and potentially the very real increased incidences of alcoholism and addiction.
No, it's a really good point. And as we have these increased demands, what ways do you think our mental health care system will need to adapt with that increased demand?
Well, without having the kind of person-to-person interaction, which frankly, as someone who's living in recovery myself, I rely on, it is going to be very difficult. We're going to have to use modalities like we're using right now, teletherapy, conference calling. I do a lot of my 12-step meetings on conference call now, many on Zoom, but there's no substitution for the group therapy that I love and I survive with, where I am able to interact with my fellows in recovery and see their faces, feel their spirit, feel their warmth, feel their embrace. All of these things are kind of intangibles, but are crucial to recovery, in my humble opinion. So I think the mental health system is going to have to obviously evolve and do what it can. Telemental health is going to be expedited as a part and an essential part of mental health. It was never anticipated to the extent that it's going to be a reality, frankly, within the next year. That can be a very good thing. There are many people who don't want to go to a psychiatrist's office, a psychologist's office, don't want to see a mental health professional. Well, now with telemental health becoming the new norm, if insurance companies reimburse for telemedicine and telemental health in the way that they would a physician's visit, then people can really have a lot more anonymity, if you will, in getting the care that they need, provided that is based upon a HIPAA-compliant technology platform, which frankly, as we all know, a lot of these platforms are not really equipped to deal with things that maintain people's patient identity in an anonymous way. So the bottom line is a lot is changing. I don't think there'll be any substitute for that in-person connection, but mental health will certainly be an additional component as we move forward.
No, and you're bringing up a really good point about what's going to stay with us. And as you talk about that, I'm thinking that there's going to be this long lasting impact on the individuals and families that are impacted by this, and just a buildup of trauma. And I'm curious, how do we keep up a spotlight on this impact? Society starts to reopen up, and things hopefully start to appear to be getting back to normal.
Well, obviously, there's never going to be the normal that was normal before. And I think that the trauma, as you point out, is going to be so pronounced in so many people, certainly our frontline workers in all of the industries and in all of the healthcare professions where their lives are constantly in the battleground of whether they're going to be exposed or not. So there's going to be trauma for all of those folks. But that now you're going to have this, until we have a vaccine, this contact tracing process where everyone's going to be tracked. And I think that, frankly, underneath that is an opportunity for us to start thinking holistically how they're going to be tracked. In other words, how are we going to track the fallout emotionally, psychologically of these illnesses when they get started because of a adaptive response to a very unnatural set of circumstances like COVID has provided us. How are we going to address that down the road? And so I think that, a checkup from the neck up, so to speak, I think that's going to have to be the new norm when it comes to all healthcare visits. And our mental health really is integrated into overall healthcare, certainly after COVID, as never before.
No, there's a lot in there that I feel like, very, very easy for us to get behind. And I'm curious, like, as you're thinking through like that crystal ball, are you worried that policymakers are not doing enough to address the mental health needs during this pandemic and then looking down the road?
Well, I think we're going to tragically face the same unprepared country that we faced with COVID. We all know now that we knew well in advance that COVID was coming. And we tried to pretend that it wasn't going to touch us. Well, that's the same attitude with respect to mental health and addiction. We always pretend that it's not going to really impact us. And then we're in the midst of a crisis, like we actually have been for the last several years, with suicide rates and overdose rates claiming 130,000 lives every year. Twice what we lost in Vietnam over the course of nearly 2 decades, all in the course of a year. And when it's all said and done, we'll lose more lives to suicide and overdose this year than we will to COVID. And I'm confident saying that, even knowing that we're probably going to get a second wave of COVID in the fall. And that should startle people. And the reason it should startle people is that we had no problem, fighting to make sure we get the PPEs and we get the ventilators. But where is our fight to make sure we get the necessary personnel and the necessary medicines and the necessary support systems in place for people who are dying of addiction, who are dying of mental illness? In my mind, that is, going to cost these lives, and we're just not paying the attention to it that we should, and we're not devoting the resources, and that's evident by the fact that we had less than 0.04% of the first $2.5 trillion massive stimulus package. 0.04% went to mental health. 0.04%. Less than 1% of all of that stimulus package went to making sure that we're still going to have a workforce and a mental health system at the end of this COVID crisis, when we're going to need it. We're expecting 60% of the mental health and addiction providers to disappear this year. 60%. We're going to see over a 50% reduction in reimbursement. So the question is, how do we make sure that on the other side of this, when we're going to have a tsunami of need, how are we going to be prepared for that? So that, like in the metaphor of the New Orleans levees, where everyone said, God, if there is a big storm, these levees won't hold. I'm here to tell you today, unless we push a lot of money through the Medicaid system, where most of the addiction and mental health providers are paid through, those levees will not hold when that tsunami of need comes down on our country as a direct result of the trauma that comes from COVID-19.
No, it's a really good point, and I'm curious, like, how people can get involved right now to make sure that this doesn't happen.
Well, if they go to the kennedyforum.org, they'll see a list of resources for themselves and for their families. They're not our resources. We've just archived and curated everyone else's resources. And what people will find is what works best for them to manage their own challenges as they are. But they'll also be able to cue in on those advocacy organizations that they want to be involved with. And what I would say is they have a chance to join, whether it's American Foundation for Suicide Prevention, American National Alliance for Suicide Prevention, whether they're going to be able to join NAMI, National Alliance for Mentally Ill, or Mental Health America, Faces and Voices of Recovery. There's going to be a lot of groups out there that are advocating. People should take time to think of what group they want to work with. And this being an advocacy month of May, and I appreciate the value of Mightier really giving us not only the tool that frankly is, and I work a lot in the IDD community because of my family's long-standing commitment through Special Olympics, which was started by my late aunt Eunice Shriver. There aren't the kinds of gamifying of cognitive behavioral therapies like Mightier provides as a platform available to people so that they can get therapy when they don't otherwise have access to other therapy, so that we're not leaving people in the lurch with no place to go. And so I salute Mightier for that. So there's going to be public and private opportunities for people to be advocates. And obviously those who are on your platform at Mightier, they do it by word of mouth. This is not something that people find out about, frankly, because there's not a lot of emphasis that there are these tools. But the good news is they're already advocates, and the best advocates are mothers and fathers and significant others who are trustees of these children, who say, here is something that works for me. I know others who are in this same space. I'm going to make sure that they know about this as well, because we all know that families that are facing the challenges of both an intellectual and developmental disability with a mental health challenge on top, a co-occurring challenge on top, they really need to have all hands on deck. So anything that they can get to help them in that, effort, they need to take advantage of. And I thank Mightier for giving them one of a handful of tools to do that, in addition to them fighting for, their school system, trying to figure out a way to fulfill their responsibility under the ADA and IDEA, Individual Disability Education Act. There are civil rights components to our public funding of education, which need to ensure that children with special needs are having their needs met at home in the same way that able-bodied children are able to go on a Zoom at home and get their lessons. So we really need to think about what are happening to those children with special needs. And as much as all of us are feeling our own pain, so to speak, in relative terms, once we think about how much more these special needs families are facing, it should put everything, we should add a dose of humility to all of us that we need to be looking out for them. They need the help more than anyone else.
First off, on behalf of Mightier, so I'm one of the co-founders of Mightier. We're in awe of everyone doing advocacy for this, and we appreciate the kind words. But like you, we're here for the many families that are in need. I think you brought up a really good point, and something that I personally have been thinking a lot about, which is I think a lot of parents have realized all of a sudden that school is not all academics all the time. There are a lot of services that are offered in school that go beyond reading and arithmetic and those general basics. And I'm curious, when you look at that and you look at your own experience, and I know Amy is a teacher as well, like what has been working well for families, and where are there opportunities where we can get better as well?
Well, I think that it's important to recognize that when kids are in school, that they're not sitting still, right? And we have this kind of false image that they're somehow, remaining in their seats through every lesson plan. We all know that their attention is going in all kinds of different directions, as well as their bodies, and that's why their day is broken up, and they have this, and then they have recess, and then they have this, and then they snack, and then they have this, and then they have, depending on their level, certain other things plugged in. So what it should remind all of us is that there's no template here. You can educate throughout the day in various forms, and that education can be in the form of playing a game. All of these games will require a bit of calculation of some kind. We can draw, and that creative part, my kids love drawing. Playing outside, if they're able to play outside, get outside, learn to ride a bike, learn to do other things. My kids have the chalk on the sidewalk, they're drawing on the sidewalk. So the point is that I think that we as parents have to just be present. That is it. These kids are seeing that things are happening. We have to be very mindful of our own stress doesn't rub off on our kids. So it's important for parents to take stock of their own needs. Like, I am conditioned to have to look at my own mental health every day. Because I'm in recovery, it's become a cognitive behavioral thing. Like, I have to think of that every day. But for folks who don't have the toolkit that I have in 12-step recovery and are now affected and may not recognize they're suffering from anxiety and depression and because of the financial uncertainty and all of the other challenges, they really have to take stock in that, because almost the best thing they can do for their kids is be aware and conscious of their own situation, because that will help their kids if they're able to be more present and not, we know that domestic violence tragically is going to see a huge increase in stressful, trying times like this. So, and that really stems from people's inability to often know how to self-regulate. In the same way we, through Mightier, help kids to self-regulate. And, just because we're grown-ups doesn't mean that sometimes we don't have all the skills we need to self-regulate. So I would say that, that's a long way of saying that we're looking for the whole experience, not just, did they get their Zoom and deal with their math problems. and so forth. But you can exchange reading. Like I'll read a little bit, and then I'll have my son read a little bit. And then the games, and then there's just a lot of those are all learning experiences, and we should dismiss them just because they're not like on screen or on a board or have pencil and paper in hand, that somehow that's not educational. All of it's educational, I guess, is my long-winded way of saying education comes in a lot of different forms.
As you're speaking, I want to end with one last question, which is, obviously there's a lot going on that is incredibly stressful, but I'm curious if you're also seeing things that you're hopeful about as we watch this pandemic unfold in front of us.
Well, I think we're reaching a point where mental health is everywhere in terms of people's identification of it as something that can be talked about and addressed. And I think coming out of this crisis, the thing that we're going to recognize is that mental health isn't for folks down there. Mental health is for everybody. And we're all living on a spectrum, whether that spectrum is a developmental spectrum or a cognitive spectrum or an emotional or psychiatric spectrum. Depression is a spectrum, and so is an anxiety. And some people have greater resilience than others. The point being that we all have to make sure that this piece of our lives, which is, our mental health and cognitive health, all of that needs to be factored into our overall health. And I think post-COVID, the hopeful is that that's no longer going to be something that's treated as something other. You're hearing about it from everybody that I've never even heard a peep from before. And now the National Chamber of Commerce and all of the AMA and all of these folks that seem to be pretty much quiet about it before are now all out in front saying they want to get ahead of this. And I am thankful that they are part of this, because now that they're part of it, we need and can use that advocacy to get what has too often been left behind in terms of the discussion.
Thank you so much. I've been here with Congressman Kennedy, who has been sharing both his views on how we can be better advocates for mental health and how we really can invest in our own system. Congressman Kennedy, it was a pleasure to talk with you. Thank you.
Likewise. Take care of yourself.